All right, you guys. So I have been wanting to do more Q&A in regards to diastasis recti. So if you're not a part of my free Facebook group, then just know, or my email list, just know that this is where a lot of these questions are coming from. So if you're not a part of these, the group or the email list, be sure to join. And I'll always put a link so that you can join those things. All right, so let's jump right into the questions. All right, so the first question is, is diastasis recti something that women are just now beginning to be aware of? I don't feel like my parents know as much. So that is a really great question. And I think that goes back to social media and just media in general being so much bigger than it was for our parents. And a lot of women, most of them are learning about diastasis recti through social media. So unfortunately, we're not learning this information from our OBGYNs. And right now, seeing a women's health PT or pelvic floor PT is not a standard part of postpartum care, which I definitely feel like it should be, because generally we're the ones that are educating women about these issues. So with that being said, a lot of women who have had children, 20 years ago, 10 years ago, maybe even, still don't know about diastasis recti, especially if they're not on social media and they're not out searching for it. So, I really take my role of educating moms very seriously and taking advantage of social media by educating you all more about diastasis recti. So yeah, I totally agree. It's not something so much women were being educated about years ago, but luckily more women being educated, especially if you're doing what you're doing, talking to an actual physical therapist or credible sources that can help you be more educated about your body, about the condition, a little less fearful about it, and being able to move forward from there. So great question. All right. So next, what can not treating your diastasis recti cause? Just leave it and struggle? So really, really good question. So, diastasis recti has kind of, you may have seen this, out there that, you can get back pain, pelvic pain, prolapse, like it can cause this long list of other issues, but that's not necessarily true. It's not so much of a causation of different things like back pain and things like that, but because your body is going through so many things postpartum, and of course having a weak core can sometimes contribute to other things. It's not always a cause of things. So you can have diastasis recti, live with diastasis recti, especially if it's not a really big, huge separation in your abdominals, and not cause any issues, to be honest with you. Now, with that being said, I'm a proponent of teaching moms and women and anybody really the benefits of having a strong core, right? I mean, that's just for functional purposes. Running around with your kids, picking up laundry bags, picking up heavy things, do gardening, whatever the case may be. Our core is our foundation and our center of our strength, really. And so I encourage women to strengthen them, even if you don't have diastasis recti. And if you do, just learning about your body and strengthening those muscles, you can never go wrong with this. So now, again, not causation, but if you are standing in such a way, compensatory, like I'm standing because my core is weak, and because I'm standing that way, I now have back pain. I'm standing like that and I'm picking up my kids this way because my core is weak. Then again, those things can kind of combine together and you end up having issues with back pain. But not everybody with diastasis have back pain. Not everyone that has pelvic floor issues have diastasis. So it's not always causation, but it's definitely can have some linking factors to consider. All right, so next question. Let's see. Can diastasis recti heal on its own without any intervention? So another excellent question, and I'm so glad that you asked this, because a lot of people don't know that, within the early postpartum period, it's absolutely natural for the separation that was once there because of the baby being inside of your uterus and the baby growing. Once the baby is delivered and out, then naturally over time your uterus starts to shrink to reduce back to its normal size without any additional exercise or intervention. And that sometimes does happen for women. And that's why we say wait to at least, 10 to 12 weeks postpartum for actually assessing to see if you have diastasis recti. Because naturally, it may naturally close on its own. Because the definition of diastasis recti is that your gap is more than 1 to 2 fingers in width. You get 2.5 to 3 fingers or more, then that's an actual diastasis recti. So again, then you can reduce down to that 1 to 2 fingers and not do any exercise at all. Now, that's the width that you're assessing there. So I always encourage women that once you reach the 10 to 12 week postpartum period, that you also assess your depth. So even though the gap may have closed down to 1 to 2 fingers and it has technically healed naturally, the tissue in itself may not be as strong as it can be. So therefore, it would still benefit for you to strengthen your abdominals, strengthen your deep core system, learn how to improve your posture, because you still have pregnancy posture, most women do. Even though you may see a woman who may not look like she is as pregnant as you are, she may still need to address things like her posture, her breathing, and things like that. There's so many other things to work on outside of the gap, but you can definitely still heal it without any intervention. All right. What if you have one side of your abdominals or DR that is stronger than the other side, more of a rib flare on one side? Should you be exercising both sides differently? So that's a really, really great question. And I love that you asked that. That lets me know you did a little research, so that's good. So yeah, you can definitely have some muscle imbalances that exist when you have diastasis recti. In rib flare, even though that's not muscle, it can involve muscles and reasons why you have that rib flare there. So you want to address that rib flare a little bit differently than you would your whole entire rib cage. So there are specific exercises that you can do on that one side to try to get that rib cage to come more down and in. That's going to include things like hard breathing. So that's something that I teach inside my program. Just learning to connect with those intercostal muscles and get that rib cage to come down and in. Also maybe using the external obliques and doing some exercises to get those kicking in. So yes, you do want to sometimes do one-sided type of exercises, especially if you have some imbalances from pregnancy where one hip may be stronger than the other or one side of your core may be a little bit weaker. So that's where getting an assessment done to see what your strength looks like is a very important part of healing diastasis. And that's why I love that you brought it up, because a lot of women give up on their healing and don't know anything about rib flare and things like that, and they're just like, oh, I have to have surgery. Well, have you ever worked with a physical therapist? Have you ever worked with a postpartum coach that can help assess and look at what's going on with your body to see, okay, there may be some imbalances that we need to address? Or have you even heard of rib flare or considered your rib cage position? And that can make a very big difference in your healing and can really help improve your core. So that's a really great question. So that's going to be my last question for this particular part. I will do another Q&A answering more questions. So of course, out of these questions that I answered, if you have any additional questions, let me know. If you listen to the end, yay. Let me know if you have any other questions that you'd like me to answer, or if you have any questions about the things that I did answer, or if you learned anything, let me know what you learned below, and I will continue to do more of these Q&A.